Well, we've all heard that taking vitamins is good for you, and a recent report highlights the benefit of antioxidants, but can you take too much or too many? Now a new book, Antioxidant Overkill, says too many can be dangerous to your health. Dr. Randolph Howes is here to explain more of that. You're not really just talking about too much at this point. It's not an overload, which is certainly bad, but just it's kind of a new radical thinking about vitamins and antioxidants and supplements.
Yeah, well, the thinking has changed so much over the past 10 years. Prior to that, we did think that these antioxidants were going to be good for us. Unfortunately, when you look at the scientific evidence, and that's what we have to go by, we had thought that they would reduce the incidence of cancer, heart disease, and strokes. But unfortunately, many of the antioxidant vitamins increase the incidence of cancer, heart disease, and strokes.
Why?
And they increase the incidence of your overall chance of dying, overall mortality.
Why?
These are very serious. Because in our bodies, some of the most important functions in it are oxidation. That's how we protect ourselves against bacteria. That's how we protect ourselves against fungi, oxidatively. That's how we protect ourselves against protozoans such as malaria, and even the HIV virus. We can oxidize the lipid coat on HIV virus and kill it oxidatively. We do not kill them antioxidatively. Our whole energy system is based on oxidation. That's how we have the energy just even to move your finger. Patients who are overloading and getting an overkill of antioxidants can feel fatigued, feel tired, because they're blocking the very system, biochemical system in their body that produces energy.
And the fact of the matter is, antioxidants are found in a lot of dietary supplements, but they're found in literally plastics and shampoo and drinks. I mean, they're everywhere.
Plastics is one of the worst. You see, a lot of these are petrochemical antioxidants from the petrochemical industry. And the bisphenol A, and you may have heard about that a year and a half, 2 years ago. This is what's found in baby bottles. And they were questioning, was this compound toxic? It's an antioxidant. Now there's hardly a person in America that doesn't have bisphenol A in their bodies, and teenagers tend to have about 30% more. They're drinking them. It's a lining. It coats drinks and the plastic bottles, the drink cans themselves. Frequently it's used in our pipes, etc. So you're getting it from all over the place, let alone the foods that are fortified with antioxidants now. I think one of the best ways to look at antioxidants and overloading or the overkill is with the ones that are commonly in the body. We have a lot in the body already. Cholesterol. But sure, we need cholesterol for membranes of cells. But what happens when we get too much? It's the primary risk factor for heart disease. Number 2, uric acid. We need it, but what happens when we get too much? Gout, gouty arthritis, heart disease. The next one, estrogen. Sure, we need it for female functioning. What happens when we get too much? We know from the hormone therapy that it feeds breast cancer. Testosterone for the male. What happens when we get too much? It feeds prostate cancer. I can go on and on with that.
Well, I want to make sure in the 2 minutes that we have remaining that people are clear and that we leave them with your message and what you have found from just vitamins and multivitamins. I mean, we've been told since I was a kid, take the Flintstone vitamin and multivitamins.
Yeah, sure.
Should people be doing that in your estimation?
I was told the same thing. Only if you have a known vitamin deficiency, or if you're in an area where you cannot have a well-balanced, nutritious diet. By that I mean if you live in Ethiopia, Somalia, perhaps you need them. In the United States, our problem is not undernutrition, it's frequently overnutrition. A third of the population is obese. The studies on even the multivitamins now, which the only one to recommend multivitamins has been the AMA. And what happened there is that there are 2 new studies, one showing that the multivitamins increase the breast density in ladies, which is a sign of breast cancer. They increase the aggressive form of prostate cancer in men, and in children they increase the risk of asthma and allergies. The data speaks for itself.
Will that come, do you think, and as more of this data comes out, that we'll have AMAs and FDAs getting more on board with maybe people should back off of the vitamins and multivitamins, or is the lobby for those products and these companies too big?
They're very powerful, but I think the word is coming, and as people become more aware of the truth about them, this is what one of my jobs, I feel, is to make people aware. And with books like Antioxidant Overkill, by the way, it's available at Amazon.com.
Okay.
Need to tell them that. And it's very inexpensive. I made them price at the least that the publishers would price it, so it can, get to the people. It's not to make money on it, it's to get the word out. Then you can decide for yourself if you want to take them or not.
All right, Doctor, interesting stuff.
Thank you very much.
Radical
Mike.
change. All right,
Appreciate
thank you,
it,
sir. Again, the best place to get a copy of Antioxidant Overkill by Dr. Randolph Howes is at Amazon.com. kittens, and more kittens. It's a kitten caboodle at the Louisiana SPCA. We'll tell you more about that right after this.